All right, that story by Sharon Momanyi comes as the Kenyan Senate is asking for investigations into the death of an accident victim who was kept waiting in an ambulance for 18 hours as health institutions. Murimi Mwangi spent the day with the ambulance attendant who witnessed the suffering of the victim in his last moments alive.
Brian Ochieng is a man in mourning. He has not lost any close relative, but the death of a man he met inside this ambulance 4 days ago has hit him hard. For over 18 hours, Brian tried helplessly to save the life of Alex Madaga, an accident victim who could not access proper treatment, apparently because his family could not raise the 200,000 shillings deposit demanded separately by two private facilities to admit him in their intensive care units. Even Kenya's premier referral institution, the Kenyatta National Hospital, declined him, saying there was no bed space at the hospital's ICU.
All the effort you put in him, they just went by the window, and then plus me trying to see how the guys were feeling, because I had put myself in their shoes to be able to help them. You can get that picture if you can put yourself in the shoes and try to feel how the others were feeling, then you really know what was happening.
On this day, we find Brian going about his duties inside the same ambulance, the environment which he says now reminds him of the pain of his now deceased patient and the tribulations of his family in the 18 hours inside the ambulance.
So it is a point that I had to teach the relatives how to park, because my driver is also human being.
But that he tried his best and still did not manage to save Madaga's life has not killed his spirit. He says it has in fact reinforced his commitment to save more lives irrespective of how callous the providers of private medical services become.
Human life is something precious. Honest, money should not be the determining issue if the person dies or not. It shouldn't. You have no money, get to them. You have the money, get to them.
And now the Senate is also demanding for answers over Madaga's death, answers which they now want the Senate Health Committee led by Mohamed Kuti to provide. While the chairman of the Kenyan Nurses Union, Seth Panyako, wants county governments to invest more resources in upgrading their hospital services within the county hospitals instead of purchasing ambulances every year, as the end result is the congestion of patients at referral facilities such as the Kenyatta National Hospital. Murimi Mwangi, KTN News, Nairobi.